Pleasure. Thank you so much. And I love your introduction on relational care and the importance of that. And I can testify to that certainly with all these different roles. And I guess another relationship I have is with my bike, which you can see me here. But this is me in front of an Action for Happiness stand in Delapre Abbey, where I'm a trustee. But I was a GP, as I say, in that relational aspect, really of just being with people and just listening. And the power of just listening. We know the evidence of this, and the Robert Waldinger study, which is the biggest study around well-being, and I use those words well-being and happiness interchangeably, thinking of eudaimonic happiness, which we don't have time to expand, but that's my meaning, eudaimonic happiness. And Waldinger describes how basically it's relationships that are the biggest predictor of happiness in later life. So you're absolutely right there, Ross. So these roles lead me into an opportunity to think about the next. This is a very busy slide, but I make somewhat no apology for it, because it is an amazing piece of work that happened in 2008, where all the experts in well-being across many different disciplines were put into a room for 2 years. And they came out with this amazing report, which I don't think has ever been superseded, around what is it that gives us a trajectory right from birth all the way through to later life. This explains, trauma, how we need to have trauma-informed therapy, because actually if you have trauma, it lowers your trajectory. But also the importance of prenatal and epigenetics, thinking that actually mums-to-be and dads should actually be thinking about their habits, because they will be affecting the genes of their children. And your obesity is set in your mother's womb. Your predictor of your weight settling point. So all of these are really super important to prevention as we're thinking all the way through. For the relevance of this talk, really, the mental capital is situated between culture and people of faith have that duality. They're people networking together, but they're creating a culture of what does it mean to be part of our community, our society, and creating values and meaning networks and coming alongside each other. And at the bottom, you've then got the recognition of the biology, and we're getting increasingly aware of nutrition. And now we need to be paying so much more attention to sleep, exercise, the rhythms of life. So, and in the middle of this, chronic inflammation. So for me, this is a superb slide that brings together the whole trajectory. I describe sperm, think of prenatal, pre-conception, all the way through to worm, or think of grief as well, and the nature of that. So I hope that's an introduction to the whole complexity that we are fearfully and wonderfully made, but it's too complicated. So for me, yes, this is very interesting, David, but let's have something simpler. So I'll come on to that in a moment. But the problem we have in our society at the moment is so much isolation, the opposite of relationship care. People are lonely. We know that has a similar effect to smoking 20 a day in later life onto your health. But compounded by this, people are then trying to self-medicate with addictions and other things, even the highly addictive food, which we're being given by the food industry, again, is creating an addiction and obesity, which just compounds inflammation and long-term conditions. So that's a bit negative to start a talk, but the opportunities. So out of the Foresight report, New Economic Foundation came up with the 5 ways to well-being, which if I quizzed you all, they're difficult to remember. And I do quiz my public health colleagues on these, which is quite a bit of fun for me. But they are the same as great. So the 5 ways to well-being are the same as great. Giving, relating, there you go. The 2 of both giving to each other, that relational care is 2 of these. Care of the body, mindful living, and learning, the cognitive learning. But then you think, why don't I do these 5? So the recent evidence really of positive psychology then helps us to think into why are we doing those? And this is the work of Vanessa King and Lord Layard, who founded in 2010 Action for Happiness. And this is an organization promoting positive well-being, but promoting the science of happiness. What is it that really helps us, enable us to grow, live life to the full? And it has these lovely aspects of direction, setting clear goals. How do we bounce back, including cognitive behavior therapy, where we get stuck and we need to have something that can unstick us. Gratitude, we know the evidence on gratitude, looking for what's good. Our strengths, using a strengths-based approach. And importantly for us all, as we think about the whole spiritual care of ourselves, meaning. If you have a meaning in your life, you live 7 years longer. Importantly, you enjoy those 7 years more with meaning. So meaning has a huge, huge impact on our well-being, and that's being increasingly recognized. These 10 keys all have an evidence base. You can go into the top QR code. That will take you to a 10-day course. The great thing about Action of Happiness, two things: it's free and it's evidence-based. So those are two things. And we've been celebrating this in Northamptonshire for some time. If we took personal action in those 10 keys, we could become happier. There's no guarantee, but if we move from that struggling to self-care, we can, if we take that action into the communities, find the communities we all want, supporting each other, giving, relating to our neighbours, we can end up with thriving communities, neighbourhood health creation. And that's what we're really hoping to achieve. And that's, I could share evidence of our evaluation from the University of Northampton that describes something of what we've done with £1 million social impact. This is actually the book that Ross was talking about, by Sir Nigel Crisp. He was the previous chief executive of the NHS. He came up with 10 things that we should be doing to create neighbourhood health. For me, they rather nicely map into the great dream. Interestingly, he didn't think about the care of the body, which I would argue is one of the strongest outcomes we can actually do, just getting people walking, exercising together and eating together. But the other aspects are all there. The importance of volunteering, the focus on relationships, and importantly, to take off our NHS spectacles, leaving behind preconceptions, and to be entrepreneurial. So I think some real opportunities. Action of Happiness has a main focus, and I would agree that we need to have this autonomy, the sense of self-determination theory, how we take care of ourselves. The NHS is, to my mind, should be called the National Illness Management Service. Health is made at home, and faith communities in particular have a real opportunity to speak into this space, because they've been doing it for many, many years. And the words they teach are about whole person, love, meaning, as we've just heard. All of these now, research evidence is showing, gives huge impact to our health and well-being and our longevity. So diving in now to that introduction around health and well-being and the importance, I hope I'm now going to just talk really about where does the faith community sit? And it really sits under the radar a lot of the time. It's actually been doing a lot of this work and continues to do it, but not really as part of a whole system approach. And that's what I'm hoping we can just consider. So we have all of these huge number of buildings that exist in communities that are doing this. And actually the relief of 8.4 billion is just in 4 areas. And that was just in addictions, children's services, mental health, and one other that has escaped me. But it just is 4 areas of what there's a lot more going on in our churches. A key fact, which is just useful just to focus on, for every £1 you invest in churches, there's a £16 return. That is a staggering figure when you look at social prescribing, which we all agree is something of great value. £1 invested gives about a £4 return. There's a lot of medicines that actually don't give anywhere near that level of return that we give out every day at great cost. But I just make that point there. So how to make the difference, these bridges between this work that's going on in faith communities, and we could hope we will share and continue to share this real work that's going on nationally, great examples, with this new model of care of social prescribing, which is coming in. There's these 2 agencies trying to do the same thing, help people live life to the full, whole care. So how do we do this? So this was a piece of research. I had the privilege of being part of the advisory group too, which is really looking at the opportunities and barriers. And importantly, they came up with these 2 toolkits, one for faith communities to say, well, I don't know who these social prescribers are. What do they do? It tells you who they are, how you can make those links. And likewise, to give permission for social prescribers to make some links with their faith communities and how they can do so. And this is national work that's going on. We've mentioned the Good Faith Partnership. There's other partnerships, the Gather movement, other organizations bringing people together to understand how this can be more effectively achieved. And, it's really, I think everybody needs to kind of network and build on this opportunity. So that's some great research. And again, the QR code, and I'm very happy for these slides to be shared so that you can actually all have these links and make those connections. So we took this into our local community, into Northampton, a central local area partnership. It's about a population of about 90,000 people, but it has a lot of deprivation there. 90 faith communities exist in that 90,000 population. And I've heard other people say that there's actually more faith leaders than there are medics. And that is quite an interesting point, isn't it? When you think of health, but actually there's more faith leaders, and actually internationally, definitely, health is created by our faith leaders and people. That's the first people will go to. And I had that from a leading, from Jonathan Campion, who's one of the most respected people around prevention and promoting mental health internationally. So that's an interesting point. So mapping faith organizations, 90 exist. Each of those have about 10 volunteers. So there's about a population, a workforce of 1,000 people every week delivering something into their community. And they really embody this whole, and I'm really privileged that nationally there's a real push for this VCF. That's how to say it, because often people get their teeth or whatever, but it's a VCF, SE, putting the F in the middle and putting faith communities at the heart of this opportunity of the third sector, that we can really ripple out and resonate into our communities. And we did a survey with 16 responses, and what we found was really there's an under-integration, and maybe not brilliant English, but the bottom line is they're under the radar, but they're not actually getting stuck in or networked in the right way. Fragmented referral pathways, transport accessibility in so many ways. We could look at that word of accessibility, but communication gaps, just understanding what each other's does. But meeting together has been very powerful, and there's many examples of how that's been overcome. There are some building needs, some specific issues around safeguarding and sharing policies and ongoing learning and mental health awareness. It's such a complex field of just knowing who to link with, more than just 111 option 2. What else is out there? The little groups, the knit and natter groups, how we can network people into these small social connections. And also importantly, funding, getting bid writing. Some of these skills just aren't available. So lots of maybe funding around, but faith communities can't network into it. So actually, and the modest amount of money could actually unlock a lot of resource. The next steps for us, we are privileged that we actually do have this website called Wellbeing Launchpad. Other people may know a Joy app or other ways you can network your resources or have a directory service that can link with primary care. That's our local one. But because it's local, we have enabled faith groups to be linked into it. And so these groups can then be linked up. As I've said, we actually have a hub in Northamptonshire around Action of Happiness, which is an exemplar hub of how we can link people together. And we're beginning to work in hyper-local clusters. And I put that as an opportunity of neighbourhood health creation. The NHS has defined a neighbourhood, certainly in our own area, of 100,000 population. To me, that's a town, but it's not a neighbourhood. And so the opportunity of how do we work together? But churches are neighbourhoods. Churches are really, they bring people from their own community together. And that was something of the deep dive in our own research, which I'm very happy to share. We've got 5 deep dives, which really take you into the stories of lived experience of these people and the difference churches are making. But it's an opportunity for us to really think of longer term. So just I'm doing a high level opportunity. How does this then work into health? And for me, a lot of mental health services just lies in this red zone. For me, commissioning mental health services, it was mainly the red zone. How do we actually look at the crisis pathway? More recently, indeed, with Lord Layard Still in 2008 came IAPT and talking therapies, and we have a bio moving to a psycho. And then more recently, we've had the social aspects of social prescribing, linking up all these opportunities. And again, great networks nationally, and again, churches and other faith communities leading into the warm spaces, food banks. 50% in the survey of our local area partnership were provided in faith communities. Again, so even when there's this offer from the councils, it's often the faith communities who step up and have that capacity to deliver. That's just something to mention again. But it's also this recognition of, as people come up this journey, I've had my own journey of this mood disorder pathway. It's a spiritual growth, recognizing that sometimes actually, as we come out of trauma or difficult times, if we can offer it up, then actually there can be growth. And there's a real opportunity that we can learn and share together and grow. What are we doing locally? And just to put this up and to share it, we are linking with parish councils who are already great conveners. They sit under the big council, so 10,000 population, and we've found them such a breath of fresh air. I would say that in working with the health service, I've achieved more in 5 or 6 months than I have maybe with 5 or 6 years with the health service, of bringing in true health into a community, because they already have these networks happening. And we're looking at the movement, how we can be promoting positive movement and activity alongside mental health, but also just thinking of how that can fit into children, young people, family hubs, think family, schools, but also with leisure providers. And I will just mention the Chapel Gym in Corby, heart of Corby, and leave you with this picture of heart of Corby, very deprived area. A church was going to close, but a gym was local, also being pushed out by the increasing rent. They joined up. And so the gym moved into the church, 300 people. It's now got over 1,000 members, and they're looking at doing a bigger building because they've got so many people joining. But they kept the chapel. So it's a place where people can have prayer and thinking alongside leisure. So these type of opportunities are really how we can maybe begin to think of future whole person care.